All right, this is kind of crazy if you think about it. Every single day in the U.S., 25,000 people sprain their ankle, and more than 1 million visit ERs because of ankle injuries. So it's very common, and it is a specialty of my next guest. Dr. Nicholas Cheney is a surgeon with OrthoNeuro. Good to see you again, doctor.
Thanks for having me.
All right, so ankle sprain, right? We hear about it, I feel like, all the time. I mean, kids doing sports, running in the yard, you can do it so easily. What exactly happens, though, when you're getting an ankle sprain?
So an ankle sprain is basically when you turn your ankle in. So if this is an ankle, when you step off a curb and your foot turns inward, you tear ligaments on the outside of the ankle. So there's basically 3 grades of an injury. You can strain it, you can partially tear it, or you can completely tear it.
Okay.
And so depending on the damage to the ligaments will kind of give us a ballpark idea of what the length of recovery is going to be.
Okay, depending on each of those. And so how do you know you have one? I feel like often people, it's painful. So you automatically probably assume, oh, I broke it, I did something really bad. How do you know if it is just a sprain? It's
really hard to tell without an x-ray. So as an orthopedic resident, I sustained an ankle sprain. I thought I broke my ankle, swore it was fractured, went into the ER, got an x-ray, it was sprained. So you don't really know without an x-ray that there's nothing broken. So that's how you tell.
All right, so let's talk treatments of it. What do you do when it is a sprain? What do you do when it's something further?
So sprains never need surgery, all right? So an acute ankle sprain does not need surgery. It needs rest, ice, immobilization, ultimately some physical therapy. It's the ankle sprains that go untreated or inappropriately treated that lead to some subtle instability in the joint that then leads to surgery long term.
Okay, so when you're talking about that then, if somebody has had maybe multiple issues, right, not gotten it checked out, something like that, when does it turn into an issue?
So if somebody's walking around, we ask them, do you have a hard time on uneven ground, uneven surfaces? Does the ankle give way frequently? Those types of problems.
Okay.
Then we can do some imaging studies. If they've failed conservative care, they've got those problems, sometimes that leads to surgery. And
you mentioned that there's kind of different levels. So you talk about sometimes a high sprain.
Right.
What is the difference in that?
So you'll hear about athletes getting a high ankle sprain, and it's a totally different mechanism of injury. So instead of the ankle turning inwards, the ankle twists outwards. And so you've got the joint between these 2 bones up here that tethers them together. And so the ankle twists out and basically tears through the ligaments above the ankle joint. And so every step you take as the ankle bone moves up, those ligaments are stretched and it causes pain.
Is it better, and I've heard this before, to break your ankle than to suffer a sprain?
I get patients that say, oh, I've been better off if I'd broken it. Well, no, because a fracture a lot of times will lead to a surgery. The reason they say that is it's about 6 weeks for a bone to heal, 12 weeks for a soft tissue ligament injury to heal. And so the recovery time is shorter, but you're out of the operating room with the sprain, and you're potentially in the operating room with the fracture.
So when you have to get surgery, what is entailed in that? I mean, is it an extensive surgery? Is it something that can be done?
Ankle fractures are something that's exceedingly common. Most of the time, they're very straightforward. Patients do exceedingly well with them. Basically, all we're trying to do is maintain the stability of the joint and preserve that. So I like analogies. So if you've got a tire on a car, you want the tire to be balanced so the tread doesn't wear out.
Got it.
A human joint is no different. It needs to be balanced. And if the joint is not balanced, you'll wear the tread out, which is your cartilage. Cartilage loss leads to arthritis. So we're basically trying to reestablish the mechanics of the joint to protect it long term.
And speaking of protection, are there things we can do, even for our kids, for our athletes, things that we should be more aware of to kind of help them prevent some of these?
Maybe appropriate shoe wear, appropriate bracing, depending on the activity that they're doing. Taping, bracing, there's pretty equivalent. So if they're in activities where they're cutting a lot, if they've sprained their ankle once or twice, maybe consider doing something like that long term.
And should they always go then and see somebody, you're saying, when there is some kind of ankle injury?
Well, if you want to find out if it's broken or not, it's really hard to say if you don't have an x-ray to confirm and are evaluated. The problems arise when you don't get something treated. You get the chronic instability. You end up with arthritis. And so dealing with it early is a lot better than dealing with it late.
Right, so to let it go and see what happens. Okay, so then definitely if you've gotten an x-ray, you find out, you want to go to somebody who knows what they're doing. Obviously, OrthoNeuro, you guys are very specialized in this issue and can take care of anybody and in all ages, right? I mean, of people who have these issues.
I saw a 2-year-old this morning before I showed up here. With a fracture of the ankle, and so we treated it. And I saw an 85-year-old patient this morning with ankle instability from chronic sprains, and so we casted one, braced the other, and so yes, all ages.
All ages. All right, all starts with a phone call, of course. It is OrthoNeuro. All the info up there on screen for you. Thank you so much, doctor.